Hello po. Good afternoon, everyone. Magandang hapon po sa lahat and happy National Innovation Day. So I am Pamela Pasco. I'm Dr. Pamela Pasco, Hub Manager of CHI Philippines, and I will be moderating today's webinar. So I would like to welcome everyone to the official Country Hub launch of the Global Health Network Philippines, aka TGHN Philippines. So this event is organized by the Social Innovation and Health Initiative Philippines, or CHI Philippines, in close collaboration with the University of the Philippines, Manila, TGHN Global, and CHI Global Network. Next slide, please. Okay. So this is the brief program that we'll be having for today. We'll be following this, starting with a message from Dr. Beatriz Halpao from the Social Innovation and Health Initiative Global Network, followed by a welcome message from Dr. Salvia Zishan from TGHN Global. After that, we will be giving a brief overview of TGHN Philippines, spotlighting our current member institutions before ending with a Q&A segment. Next slide, please. So without further ado, I would like to welcome to the floor Dr. Beatriz Halpao, from the co-founder and senior program manager of CHI Global Network. Beatriz.
Thank you, Pamela, and thank you for the CHI team in the Philippines. It's a great honor to actually open and give a message of support to this meeting, this launch, which I think is an amazing example of synergy across global networks. I'm very pleased as the CHI co-founder to bring all the pieces between CHI network and then the Global Health Network in the Philippines together in order to see the great opportunity for synergy. So the Global Health Network has a continued commitment to strengthen research capacity and fostering collaboration across networks such as the Global Health Networks and other networks like CHI. And CHI is a vibrant global network that is focusing and dedicating to accelerate universal health coverage through social innovation, community engagement, and social justice in low and middle income countries. And research capacity strengthening is one of the key elements of CHI. It helps enhance the effectiveness of social innovations, foster their scale-up, and also enhance their impact on universal health coverage. What we call as social innovations are solutions that solutions for health issues and healthcare issues that are inclusive, that engage communities, and that have a social and a health outcomes. So there is also a second key element in social innovation in health in order to make a difference is its convening pillar, convening the various stakeholders around the same table or platform. And this includes the social innovators, includes the researchers, government representatives, communities, of course, and NGOs, private sectors, donors, etc. And the idea is to really bring all those parties together in order to develop ownership and to work best together to embed the social innovation in the system so it can be sustainable. And the research capacity strengthening is the third element in order for CHI to make a difference. And it is about really democratizing research, making research reachable, but non-researchers working together with research, and in order to really see what works, what doesn't work, and how to enhance the social innovations. So through these 2 and 3 elements, then there is a great synergy with the Global Health Network in the Philippines. And it's nice to see that several universities are, there's like 4 initial universities that are joining. So it's like what I would call a win-win-win situation, where this collaboration is going to strengthen CHI, the Social Innovation in Health initiatives, at the global and at the Philippines level, going to also enhance the Global Health Network, global, and also at the Philippine level, as well as being also for all the different universities that were not part of CHI or the Global Health Network, and that are bringing and coming to work with the University of the Philippines in Manila. So I'm very proud and very honored at the same time to really see the CHI Philippines, the CHI Secretariat joining and hosting the Global Health Network Philippines, and I can't wait to see the synergy of this on the ground. Unfortunately, I will not be able to stay on this launch, but will be very happy to see later on because I have other commitments, but we'll be very happy to really hear how the discussion went. And I wish you really successful discussion in looking at opportunities and looking how each of the individual university in the Philippines can bring something to this amazing collaboration. So I think it's a great day to see CHI joining other global networks and embedding in all these synergies. So thank you so much for inviting me to speak today. And again, congratulations to Dr. Meredith and Dr. Pam and all the team. It's fantastic event. Thank you. Pam.
Thank you so much, Dr. Beatrice. We are truly honored to be partners with the Greater CHI Global Network in this initiative. So I agree that it is wonderful to see the synergy between these different global networks, and more importantly, bringing these into local stakeholders networks for socially relevant action and community engagement. I think I'd just like to highlight some keywords today. So I think those are equity, collaboration, and health research. So next, I would also like to welcome Dr. Salvia Zishan, Senior Project Manager of Regional Programs of the Global Health Network at the University of Oxford, to give an official message from TGHN Global. Salvia?
Hello, thank you, Pamela. Thank you for the introduction. My name is Salvia, and I'm the Regional Programs Manager at the Global Health Network. I'm here to give a broad overview of the Global Health Network. I'm just waiting for the slide to turn. Thank you. The Global Health Network is a vast community across the world with the goal of bringing equity in where research happens, who leads it, and who benefits from it. It works to enable research where evidence is lacking by connecting health researchers, research organizations, and communities, facilitating knowledge sharing, and building research capacity across diseases, types of research, healthcare settings, organizations, and regions. The Global Health Network is also a WHO collaborating center for research information sharing and capacity development. Next slide, please. So the Global Health Network was established to bridge the gap in evidence, or the 90-10 gap, which means that 90% of the research that happens is benefiting only 10% of the population. And this exists because very few studies are undertaken in the global south, and out of which very few are led by local researchers, and out of that, even fewer are led by local priorities. The global health research inequity is like a pyramid, where the top of the pyramid is made up of the big grants, the expensive trials, and the low cost and locally led studies form the base of the pyramid. And that is what the Global Health Network is doing, which is to flip the pyramid. It does so by making knowledge accessible, like the best methods, tools, and training to those in the low resource settings, so that every healthcare setting can undertake research and evidence is generated from locally led studies that are low cost, accessible, achievable, and can bring about immediate impact. It is about giving healthcare professionals, teams, and researchers the knowledge, skills, and confidence that they do not need the big research programs all the time, and they can do very pragmatic research on measuring what's right in front of them. And so that is what the Global Health Network is trying to shift. Next slide, please. The Global Health Network has grown over the years with members and partners across the globe who push the objectives of the Global Health Network in the regions, and they are supported by the Global Operations team in Oxford. The Global Health Network currently has over 60 research organizations and networks across the regions of Africa, Asia, Latin America, Caribbean, and the Middle East and North Africa, and it has over 1.2 million members who are researchers, practitioners, and healthcare workers connected with one another. Next slide, please. The Global Health Network had undertaken a study in 2023 with over 7,000 participants. One of the questions that was asked was about barriers for undertaking studies in infectious diseases. And this graph here shows, it summarizes the data from the responses to that question, and it shows that the barriers do not necessarily vary between the disease areas, type of research, or geography. Although typically the approaches to capacity development are highly fragmented, short-term, and inefficient because they are led from the perspective of one disease area, any one particular program, or training for one study team. So we know that barriers are largely cross-cutting, so they have to be solved efficiently by working together. We need to do research system strengthening as a whole. Next slide, please. The Global Health Network has a vast digital platform that connects research organizations with individual researchers, teams, and healthcare workers. This makes knowledge highly accessible and gives the ability to transfer know-how, information, tools, and resources. The goal is to ensure that a research team anywhere in the world can find and use the same standards, tools, methods, training, and support for their research. There are many knowledge hubs on the Global Health Network platform, and each distinct knowledge hub is a very active and effective community of practice, providing a neutral mechanism for the partners and project grantees to share their know-how with each other, but also with the wider research community working in the same disease area or research topic area. Each hub also benefits from being located on a wider platform, similar to organizations benefiting from being located in a physical science park. Next slide, please. The knowledge hubs on the digital platform work alongside both in-person and online research system strengthening programs that are delivered across the globe through regional partners and through workplace-based learning, local research support activities, and professional development for research teams. So this combined virtual and in-person approach accelerates progress and raises standards and brings efficiencies in strengthening systems and careers. Some of the research capacity strengthening activities are research clubs, supported classroom sessions, research topic focused clinics, and twinning programs. And there are toolkits and resources available for teams so that they can plan and implement them in their local setting for building research capacities. Next slide, please. The Global Health Network exists as a decentralized organization with partner institutes forming country hubs to provide research capacity development support at the country level. Some of the country hubs also have research capacity and knowledge exchange coordinators funded to work in local institutes to deliver the practical approaches that improve research capabilities in that location. This is highly scalable and sustainable because the regional partners can seek funding that goes directly to them and still be a part of the global health network. Next slide, please. There is a very impactful mechanism for strengthening research systems and mobilizing knowledge, and they are the research clubs. It requires a group of participants in any setting getting together on a regular basis and sharing their research in progress. It is highly participant driven. It can be run in a low resource setting, supports peer networks, identifies local priorities, and can provide a route for participants to access learning tools and resources. Next slide, please. The Global Health Network is used by organizations such as the WHO, CEPI, IDRC, EDCTP, and Wellcome Trust to reach the research community and deliver systematic methods and research system strengthening. Next slide, please. There are tools, resources, recordings of webinars, workshops, e-learning courses, and career development tools available on the Global Health Network platform for delivering skills in all areas of health research and supporting career development and lasting capable teams. Next slide, please. The Global Health Network has impact assessment and measurement built into every project and program. What is tracked is access and activity in person and online, and also followed up on the difference this made to their research and practice. This is a very powerful way for partners to assess the wider outputs from their research grants. Each course taken or document found and used, collaboration formed by an individual or a team, is a step or a process in planning, delivering, or reporting of the research study by making it easier or of higher quality. This happens over time and creates pathways to impact. It enables numerous teams to grow research centers that win grants, work as trial sites, or have career pathways, and generates quality evidence through locally led studies. Next slide. There are multiple ways in which the Global Health Network is directly impacting the Sustainable Development Goals. There is also a very important update from the Global Health Network, and it is a very powerful opportunity to scale up as the Global Health Network has been invited to set up a new project as the new UN Ops. And what this will help is provide the Global Health Network and its partners the ability to employ local staff in the region on full contracts, provide safe funding route directly to the institutions. The University of Oxford continues in its role providing a platform for knowledge mobilizing methods, education, and providing expertise. So the UN Ops will provide a significant acceleration for the Global Health Network to strengthen research capacity in all healthcare settings, and especially where evidence is lacking. Next slide, please. So thank you. This is a picture from Cape Town and includes some of the partners of the Global Health Network. And we are very excited to see the Global Health Network Philippines grow in huge capacities. Thank you very much.
Thank you, Salvia. So it's so amazing to see how many resources are available on the platforms of TGHN, and even more exciting to see that a lot of collaborative activities are being done through TGHN and across different organizations. So we would also like to acknowledge the presence of Professor Trudy Lang, the head of the Global Health Network. So thank you for joining the session despite the difference in time zones. So now that you've heard about what TGHN is on a global scale, I'd also like to share a bit about TGHN in the Philippine context, or what we have so far. Next slide, please. So to summarize, TGHN is a global collaborative platform that strengthens research capacity by providing tools, training, certification, and networking to improve health research quality and equity. So it promotes interdisciplinary collaboration, ethical research practice, and knowledge exchange across institutions and countries, engaging with more than 1.2 million members. Next slide. So the Global Health Network works across all aspects of health research to first embed health research in places, diseases, and regions where evidence is lacking. So by bringing support, training, and guiding faster, easier, and better research processes, it drives equity in who takes part and who benefits from health research by enabling the open movement of health research information, data, and know-how between disease areas, regions, organizations, and communities. And lastly, it builds lasting capable research teams in low resource settings who are able to lead research studies and compete internationally for recognition, reward, engagement, and visibility. So next slide. For TGHN Philippines specifically, this national network is convened by University of the Philippines, Manila through CHI Philippines, or the Program on Social Innovation and Entrepreneurship in Health under the National Institute of Health, in close collaboration with University of Oxford. So activities have actually started since October 2024. These are various meetings with these founding members, and today marks the formal introduction to the public of the network and its founding member institutions. Next slide, please. So just a bit about CHI Philippines, as we are the country's convener. Through our experience in network building and research capacity building, we hope to expand CHI's and TGHN's ecosystem building and embed social innovation into wider global health research and implementation. So for those who might not be so familiar with social innovations in health, these are actually ground up and community-based initiatives that aim to address health system gaps at the grassroots. So through multisectoral collaboration across diverse community and system actors, social innovations have been proven to be effective in bridging gaps. So CHI has successfully identified locally several social innovations through our flagship activity supported by PCHRD, the Helio Castillo Award for Research on Social Innovations in Health, or GCARC. Next slide, please. So, as mentioned, the TGHN Philippines Country Hub serves as a bridge between Philippine institutions and the global health research community. So after our initial meetings as a country hub, we have developed the following initial objectives. So first is to map institutions engaged in global health work locally, conduct a needs assessment for knowledge gap and research skills, link local stakeholders with TGHN global resources, and organize capacity building activities in global health research. So as of today, the latter 2 points, the ones on the right, are ongoing and are also future activities of TGHN Philippines. Meanwhile, preliminary work on the first two have already been done, and actually we're here to share with what we've found so far. So next slide, please. So based on our various meetings and exploratory forums with member institutions, we have identified the following findings. So our institutions collectively have strong research backgrounds on health systems and access. So these are particularly in fields of population health, One Health, and disaster risk reduction, all of which are also actually aligned with the Sustainable Development Goals. Our members are also engaged in various education and capacity building initiatives with local government units, public health agencies, and international partners. Global health perspectives have also been integrated into the various courses offered at partner universities. So this emphasizes preventive care, health equity, and sustainable healthcare practices. So actually, students are also known to form organizations with global and public health advocacies. So on the flip side, however, we've also identified the following gaps. So there is fragmented collaboration in terms of evidence generation and knowledge translation, limited access to funding, and capacity gaps in research, such as inaccessible software and limited knowledge in advanced methodologies. So next slide, please. So still, the following opportunities and activities can be implemented and leveraged. So such as TGHN e-learning and certifications, interdisciplinary research and collaboration, research grant writing capacity building and workshops, technical assistance in ethics and policy translation, international research exchange, and networking programs. So all of these are just ideas and initial opportunities that we are seeing within the network. And we still hope to find more ideas and activities suggested. So apart from these, if you have any thoughts or suggestions that you hope that this network could take on, and eventually also if you would like to join the network, please feel free to just message via the Zoom chat or comment on the live stream. And we'd love to hear your ideas. You can also email us. We'll be sharing some contact details in a while. So next slide, please. So for now, you can actually find us through these QR codes, these websites. So we have first the website for TGHN Global Network, where you can find the regional hubs currently in place. And then you can also check out the TGHN Asia Regional Hub, which offers resources and materials for global health research. And of course, we have the TGHN Philippines Country Center, which will be further updated with partner institutions moving forward. So if you or your institution are interested in joining the network in the Philippines, please leave your contact details or email us at philippines@socialinnovationinhealth.org. So we'll be flashing this also again at the end. Okay. So apart from learning about the TGHN platforms, we have also prepared to share with you a little bit about our founding members. So for who are part of TGHN Philippines as of now, we have St. Louis University located in Baguio City, Benguet, Mapua University School of Medicine from Makati City, Metro Manila, University of St. La Salle, Bacolod City, Negros Occidental, and University of the Philippines Manila School of Health Sciences, or UPSHS, which has various community-based campuses across the country, including Palo, Leyte, and of course, CI Philippines as the convener. So, next slide. Let's get to know about our members a little better as we spotlight their work. So first up is St. Louis University, known for its interdisciplinary approach to health and strong engagement in rural and indigenous communities. It integrates global health perspectives into curricula, promotes service learning, and field practicum, and engages in health systems research, workforce well-being, and community-based initiatives. So, Julia, please play the video on the next slide.
Good day. It is with great pride and hope that we join the launch as an institutional member of the Global Health Network Philippines, a milestone that reminds us that the future of health is built not in isolation, but through partnership. At St. Louis University, we believe that research becomes meaningful when it transforms lives. Our work in global and public health is rooted in communities, advancing research on health systems, environmental and climate-related health challenges, and a One Health approach that recognizes the deep connection between people, animals, and our shared environment. From the mountains of the Cordillera to the national and international collaborations, our scholars, researchers, and students strive to generate knowledge that serves the common good. We are committed to strengthening ethical research governance, mentoring the next generation of health researchers, and building bridges between science, policy, and community action. Yet we also recognize that the health challenges of our time, pandemics, climate change, inequities in health systems, are too complex for any one institution to address alone. Networks like the Global Health Network Philippines create the space where ideas meet, where expertise is shared, and where collaboration turns knowledge into impact. Through this network, St. Louis University commits to contributing our strengths in research, training, and community engagement while learning from partners across the country and around the world. Together, we can strengthen research capacity, expand digital collaboration, and ensure that evidence informs policies that protect and uplift every Filipino community. Let this network be more than a platform. Let it be a movement for knowledge, solidarity, and healthier futures. Together, let us advance global health through collaboration, innovation, and a shared commitment to serve humanity. Maraming salamat at mabuhay, at congratulations to the Global Health Network Philippines.
So up next, Mapua School of Medicine advances education and research aligned with sustainability and planetary health. It emphasizes curriculum development, interdisciplinary research, qualitative inquiry, and evaluation of learning outcomes related to health, climate, and environmental changes. So they've also prepared a recording presentation in the next slide.
Good day, everyone. Mapua University is a century-old institution and one of the Philippines' premier schools in engineering and technology. What this means in practice is a strong foundation in systems thinking, innovation, and problem solving, capabilities that are increasingly essential in addressing today's complex health challenges. We bring the same mindset into medical education. The Mapua University School of Medicine, one of its newest schools, is designed to develop a new kind of physician. Our training is grounded in digital mastery, global immersion, and real-world experiential learning, ensuring that students are not only knowledgeable, but also adaptable and practice-ready. More importantly, we intentionally position our learners to engage with real-world complexity, from clinical care to community health and systems level challenges. And at the core of our model is the concept of the physician builder. This refers to a physician who not only delivers care, but who can also design solutions and strengthen systems. Grounded at the intersection of healthcare, technology, and sustainability, the physician builder applies an engineering mindset to healthcare, addressing resource constraints, improving processes, and building resilient systems. In this way, we are training physicians not just for today's patients, but for the future health systems shaped by global and environmental change. This model is operationalized through a focus on primary care for a rapidly changing planet. We recognize that human health, health systems, and environmental change are deeply interconnected, and that addressing one requires addressing all three. Primary care serves as the foundation because it is where health systems meet communities and where the impacts of climate and environmental change are most directly experienced. Our commitment to planetary and global health is not just conceptual, it is embedded across our institution. At the university level, the Institute for Global Sustainability enables transdisciplinary collaboration across health, engineering, and environmental sciences. At the curricular level, planetary health is longitudinally integrated, from early medical training to clinical application and community engagement. We reinforce accountability through the Planetary Health Report Card and extend our work globally through initiatives such as Change PH and international research on healthcare sustainability, climate-related risks, and community resilience. Together, these ensure that our approach is locally grounded and yet globally relevant. Within the TGHN network, Papua University School of Medicine seeks to contribute in three key areas. First, planetary health education and capacity building. We aim to share and co-develop curricula, training models, and educational frameworks that integrate planetary health into primary care and health professions education, particularly in LMIC contexts. Second, global and collaborative research. We are prepared to actively engage in multi-institutional research focused on climate and health, sustainable health systems, and community resilience, ensuring that research is not only produced, but also translated into practice. Third, transdisciplinary innovation. Leveraging our strengths in engineering and sustainability, we aim to co-create practical, systems-oriented, and scalable solutions that bridge clinical care, public health, and environmental action. Across all three areas, our emphasis is on co-development, implementation, and impact. Mapua University School of Medicine fully commits to active and sustained engagement in the TGHN network. We believe that the challenges we face today across health systems, inequities, and climate are inherently global and require collaborative, transdisciplinary solutions. We look forward to working with partners across the network in advancing health equity and building sustainable, future-ready health systems. Thank you so much and have a great day, everyone.
So next, we have University of St. LaSalle, or USLS. USLS houses a Center for Research and Engagement and collaborates closely with hospitals, local governments, and communities. It undertakes mixed methods and participatory research, hospital-linked studies, and supports publication ecosystems and community-engaged research initiatives. So next slide for our recording presentation.
Good afternoon, everyone, and thank you, CHI Philippines and the Global Health Network for this opportunity. I am Dr. G. Aro from EREO of the Center for Research and Engagement here at the University of St. LaSalle, Bacolod, and I am representing USLS. And we are glad to join the launch of TGHN Philippines and to be part of this shared effort to strengthen health research, collaboration, and capacity building in the country. At USLS, we understand health inequities in underserved communities as more than clinical concerns alone. They are shaped by conditions, geography, access, institutions, and the wider systems within which people live. Because of this, we believe the response must also be broader. It has to be interdisciplinary, community engaged, and oriented toward solutions that are both ethically sound and practically relevant. This is the perspective we hope to bring to TGHN. One of our key strengths at USLS is our people. Across the university, we have students, faculties, and researchers with a range of expertise, including nurses, physicians, engineers, biologists, and other fields, both with master's and doctoral degrees, who can contribute to health-related work. We see this human resource base as one of our strongest assets. For us, the question is not simply whether people or whether capable people are present, but how to connect and support them in a more intentional and meaningful way. around meaningful research questions and real community needs. A second strength is our growing health and research foundation. In the College of Medicine, for example, there has been a clear effort to strengthen our research capacity by helping medical students produce work that is relevant, ethical, technically rigorous, and sensitive to the needs of the communities. We want research to be experienced not only as an academic requirement, but as a way of engaging real problems thoughtfully and responsibly. The same is true with the College of Nursing. Through work with different communities, like our Don Salvador Benedicto outreach, colleagues from the College of Nursing have seen firsthand that access to healthcare remains uneven in many areas. That experience sharpens the need for research that is community-based, innovative, and responsive to the realities of that people face on the ground. The third strength is our research governance and ethics support. At USLS, research is supported through scientific institution structures, including the Center for Research and Engagement Office and its sub-offices, as well as our FREB-accredited Level 2 ethics review system. This matters to us because meaningful community-based research must not only be relevant, but also ethical, well-governed, and accountable. That foundation is important, especially if we want to do research to serve communities well and to do so responsibly. We also value our community grounding through partnerships and engagement with local communities, including those connected with our foundation, Balayan, and other partner sites. We continue to learn from the lived realities of people in Negros. These relationships matter because they remind us that research is strongest when it is shaped by real needs and done with communities, not merely about them. They also create space for co-creating work that is directly relevant and potentially beneficial to local context. Well, in that same spirit, we are interested in the emerging digital health, including telehealth possibilities, when this can help address real barriers of access, distance, community, and coordination in underserved communities. At the same time, we are joining TGHN not only because we can contribute, but also because of what we still hope to strengthen. One important need for us is a greater institutional coherence in research. Like many universities, we have promising work happening across different colleges, but these efforts can still remain too separate from one another. One of our goals is to move toward a more unified research agenda and a stronger culture of collaboration across the university, particularly in areas related to health and community well-being. We also hope to strengthen our capacity in community-based and participatory research, especially in working with vulnerable, minority, and underserved populations. In Negros Occidental, there are geography-isolated and disadvantaged areas, and there are also sectors such as farmers and marginalized communities whose health realities deserve more focused and equitable research attention. We hope to learn from the experience of CHI and TGHN on this area, particularly in conducting and participatory research with these groups and in integrating community and stakeholder engagement in a more intentional way. We also value the opportunity for mentoring and peer learning. We hope to connect with experts from different fields and to take part in learning opportunities that can later be cascaded to our faculty, students, and research units. In that sense, TGHN is not only a network for us to join, it is also a learning partner that can help institutions like ours strengthen internal research capacity while contributing to a wider national effort. In return, USLS is glad to commit itself as an active, supportive partner in this network. We are ready to participate in meetings, learning activities, mapping efforts, and future collaborative engagement. Whenever there is a need that we are in a position to help fill, we will do so to the best of our ability. We hope to bring the network the original perspective from Negros, a commitment to ethical and community-engaged research, and a willingness to work across disciplines in addressing health inequities more meaningfully. Ultimately, our aspirations is to help build health research that is less fragmented, less distant from the communities, and less confined within the disciplinary boundaries. We want research at USLS to be more coherent, more responsive, and more open to collaboration, social innovation, and appropriate digital health approaches where this can genuinely serve people better. So on behalf of the University of St. LaSalle, thank you once again for this opportunity. USLS joins TGHN in the Philippines in the hope of helping build research that is more collaborative, more ethical, and more responsive to underserved communities. Thank you very much.
So last but not the least, in our spotlight feature segment is the University of the Philippines Manila School of Health Sciences, or UPSHS. So UPSHS is known for socially accountable health professions education and immersive service learning programs. It strengthens community-oriented training models and promotes equitable health workforce development. So with us is Dean Charlie Labarda, who will be sharing a few words about UPSHS and will be also sharing a video from UPSHS later on after his few words. Dean Charlie.
Good day, everyone, and congratulations for the launch of the TGHN Country Hub in the Philippines. I am Dr. Charlie Labarda, Dean of the UP Manila School of Sciences, with 4 campuses in Luzon, Visayas, and Mindanao here in our country. As Dean of the UP Manila School of Sciences, we are honored to join the TGHN Philippines Country Hub, which is an initiative advancing equitable global health research and collaboration. Next slide, please. Our key focus areas is on addressing inequitable access to human resources for health, strengthening primary health care, community health systems, maternal and child health, health workforce development, and reducing inequities through socially accountable education anchored in underserved communities. Next slide, please. With regards to our strengths, we bring to the network a community-based ladderized health sciences curriculum integrating midwifery, nursing, and medicine, which is grounded in service learning and community engagement. Our strengths include community-based research and social innovations, training of fit-for-purpose health workers. We have strong LGU and intersectoral partnerships, governance models aligned with UHC and social development goals. In terms of the gaps and needs that we need support, we seek support in strengthening our research methods, digital platforms, support for data analytics, publication capacity, and global collaboration networks. We commit as an institution to sharing our SHS model for transformative health professions education, host joint trainings and community-based research. We also contribute to multi-site implementation studies, particularly those research that needs community-based engagement. And we also will contribute to mentoring early career researchers, particularly from underserved areas and communities like in South of the Philippines in Mindanao. So UP Manila School of the Sciences is committed and stand ready to work with TGHN Philippines to co-create solutions that are community-driven, equity-focused, and globally connected. Together, we hope to build a health workforce and a research ecosystem that truly serves those most in need. A short video presentation showcasing the social accountability framework of the school and the social innovations of the School of the Sciences will be shown right after. Thank you, everyone, and congratulations, everyone.
A health worker for every village. The School of Health Sciences of the University of the Philippines, Manila, a pioneer of stepladder, community, and competency-based curriculum. Established as UP's response to the country's serious problem of brain drain and the maldistribution of health manpower. Created in 1976 as a joint venture of the Department of Health, Department of Interior and Local Government, and the UP system. The first campus in Palo, Leyte, expanding through the establishment of its first campus in Baler, Aurora in 2008, Coronadal, South Cotabato in 2010, and the Tarlac campus in 2020. With the vision of being a global center of excellence and leader in sustainable, transformative health professions education directed at achieving health equity and improving the quality of life of the underserved and marginalized communities, both in the Philippines and other countries similarly situated. The students and graduates are guided with the core values of service excellence, heroism, and social accountability. Faculty are highly qualified with a wide array of academic and work experiences, with state-of-the-art laboratory equipment and other learning facilities, and student support services to promote academic success. What makes the school unique are its features.
Students do not apply for admission but are endorsed by their communities and exempt from the UP College admissions test.
Between program levels, students are required to undertake service leaves in their home communities to integrate the instructional content and processes learned into a unified and understandable whole.
Students render return service for 1 year for every 2 years of schooling.
SHS through the years is able to recruit close to 5,000 scholars from 77 provinces all over the Philippines. Passing rates in national examinations, diploma and midwifery with a 97 to 100% passing rate with examinees consistently in the top 10. And Bachelor of Science in Nursing with an 86 to 100% passing rate, also with top examinees. Doctor of Medicine has licensed more than 80% of its graduates with top placers also. SHS is the only college in UP Manila with an 80 to 90% retention rate of the graduates serving the depressed and underserved communities, and acclaimed and evaluated nationally as an effective strategy to fill in the need for health human resource in underserved areas of the country. UPSHS will continue to live its core values of serving the marginalized communities with service excellence, heroism, and social accountability.
So those were the founding members of TGHN Philippines. So to all our member institutions, thank you so much for your contributions to the network so far, and we look forward to working with all of you. So as we request our tech team to enable the participants to turn on their videos and also unmute, and before we open the floor for our Q&A, we would also like to acknowledge and thank the representatives from our member institutions who have been coordinating and discussing with us in the past year to make this TGHN Philippines happen. So among these who presented earlier, so from USLS is Dr. J. Aro, Dr. Fred Ting, Dr. Frangelo Tampos. Feel free to turn on your video po and say hi or say a few words if you would like. I believe our tech team is already enabling all participants to participate. And then from Mapua School of Medicine is Dean Maya Santos and Dr. Jake Cortez. From SLU is Dean Farida Cabigat Weatherick, Ma'am Michelle Lamadrid, Ma'am Stephanie Busbos, and from UPSHS is Dean Charlie Labarta.
Good afternoon, everyone.
So, good afternoon po. Thank you so much for joining us this afternoon. And also thank you so much for preparing those segments to highlight the different and the variety of our member institutions from the different regions of the country for TGHN Philippines. So now we are actually opening the floor for any questions, comments, or insights. So please feel free to raise your hand or so we can call you, or you can also send a message via chat. Or our member institutions, if you would like to share anything or say a few words, the floor is also open, of course. Okay, so maybe to just get the audience thinking, we actually have a question for you. So we would like to ask the audience if with all of these, we've talked so much about the different member institutions. We've talked about TGHN Philippines and TGHN Global. So among all of these, are there any ideas that resonate or any ideas that have been discussed or presented that you feel like is impactful or is a key takeaway or like a key word? So there are no right or wrong answers. Feel free to just send a word in the chat box. We'll be reading them out and sharing with everyone. I think, Julia, you can stop screen sharing first. Thank you so much. Okay, as we wait for some questions, I think we can take one photo with the panel first. I'd like to ask the help of Amara to facilitate this.
Or okay. Ready. 1, 2, 3, smile. Okay. Another one. 1, 2, 3. Okay, thank you.
Thank you so much. So, I think, okay. So as we are waiting for questions, or if there are no questions, actually, if there's some time needed to process all the information and the exciting opportunities that TGHN Philippines offers, we will be sharing later on again the email, and please feel free to email us your questions. We can forward these to our member institutions and as well as to TGHN Global and the CHI Network. Okay. So Dean Charlie, yes.
Yes, I forgot earlier to mention that this April 29 we'll be launching our 50th year anniversary celebration in the UP Manila School of Sciences. So inviting everyone, if you are near our main campus in Palo Leyte, or if you're traveling in Leyte last week of April, please do drop by our School of Health Sciences. We are gathering together the alumni from 50 years of the work of the School of Health Sciences, our stakeholders as well, and from the different government agencies. And we'll be holding a short program together with our local government partners and communities. So if you're able to drop by, please feel free to join us, and be happy to accommodate you and host you as well.
That sounds exciting. So I actually just went to Tacloban last week, and it's a really wonderful place. So if you're able to drop by, I think it would be wonderful to join the festivities in UPSHS. So actually, that's all the time we have for our. We went a bit of overtime with our webinar, but everything's really exciting. So I would like to welcome to the floor Doc Meredith for her closing remarks and messages to everyone.
Thank you, Pam, and good afternoon to everyone, to our partners, both internationally and nationally. I will not make this long because I know everyone is busy at this time of the year, but let me just convey our thanks and excitement